This episode of HIPcast is brought to you by Enterprise Social Record, the only closed-loop referral solution for social determinants of health needs built with health information expertise. ESR allows clients to assess, refer, report, and trend the SDOH needs of people in their care. Report quality metrics like HEDIS and MIPS. ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. And welcome to our episode here about entrepreneurship in health information. We are excited about this one. This is going to be a fun conversation with my co-host, Shannan Swafford, and also guest on this episode, Shannan Swafford, and her business partner, Max Lint. So this is going to be a fun one to talk about entrepreneurship. One of the prep emails, Max mentioned many failures and that produced quite a bit of fear over me. I'm so conservative. It is not funny. My wife says that I squeak when I walk because I'm scared to do anything. I'm scared to spend money. So
he's not scared to do anything. He might be scared to spend money, but he is definitely a risk taker.
I am as cheap as they come. So Max is an experienced entrepreneur in enterprise solution development in multiple industries such as manufacturing, distribution, healthcare, and more. He has experience in acquisitions, selling assets, turnarounds, and startups. And here's the line that got me. Max has failures and successes as an entrepreneur. And then Shannan, as many of you know, my co-host and wonderful friend, has over 25 years as a health information professional. She's a lifelong learner and a bit of a healthcare rolling stone. I liked that in your bio. With experiences in hospitals, provider offices, health plans, IT, and a QIO. Dr. Swafford has enjoyed a unique view of the healthcare industry, recently moving from a corporate role. She now works alongside business partners, creating solutions for hard to solve data flows for bridging gaps. So Shannan is a health information professional that has jumped out of the traditional space that we all live in and decided to be an entrepreneur, which, again, it brings incredible fear. So I'm hoping after today's episodes, you guys have convinced me to be an entrepreneur, perhaps, or at least some of our audience to take the leap.
I don't know, Seth. Right now I'm 0 for 2. So maybe you should wait until maybe we should record this later.
That pretty much solidifies where I'll be as an entrepreneur.
Oh, my goodness. So good morning, by the way. How are you?
Morning. I'm good. How are you?
Yep. Very good.
I don't think it's interesting that the failure part is the thing that Seth kind of focused in on. Most people don't think about it, but that's a reality. But you know, there's a good thing out of that, Seth. The reality of failure is you learn a lot. I mean, I've learned more from failures than I could have ever learned getting an MBA. Literally about they're tough events, but for most people, they're inevitable. I mean, even when you look at people that are extremely successful today, they have failures in their past, most of them. There's a few that have done it without failures, but it's rare. I mean, it is extremely rare that anybody you know that you think is a success, if you dig deep enough, you'll find some failures in their past.
That's pretty good. I guess in the regular corporate world that I've worked in hospitals and whatnot, there are project failures and things like that, but it feels like there's always a safety net, right? But in the entrepreneur world, I don't know that there's a safety net. You're going to hit the ground when you fly off that trapeze.
Yeah, there's no safety net. There's no safety net.
No, that corporate security that's corporate security. That's false. That's not real. I mean, layoffs, reductions in workforce, getting a new boss that doesn't like the way you align with their, I mean, there's really no security, but there is probably a little more. I do like it when somebody pays me. So I do miss getting paid. But the freedom to create, being an entrepreneur, the freedom to create is just amazing. So, but I want to know, Max, could you just give a little bit overview of your corporate work history?
Yeah, I actually intentionally worked for private corporations most of my career. I had one brief stint where I worked for a large publicly traded company, and it was a sobering event that I was really young. I was actually a COBOL developer when I was going to college, and worked for a publicly traded company for about a year, and realized how they just didn't align with how I wanted to work. There were so many politics and things going on, and things were sabotaged because of people wanting to show who had more power than somebody else. And it was like, I didn't ever want to work for a publicly traded company after I experienced that. And then the private companies were interesting, but what I learned there was, I learned a lot. I mean, I was lucky and was mentored by some great people and learned a ton of things. But like Shannan said earlier, there's no security in being employed at a corporation. It doesn't. Yeah, there's somebody else that's taking care of financials, and they've got stronger banking relationships, and they can negotiate better financial terms, even when they're struggling cash flow wise. Employees might not know it, but most people get paid at a regular, timely basis, and that's all great. But you never know when you're going to be let go. And it might not be anything to do with your performance or your contribution, but likewise, you're not compensated based on how well you contribute either. I left a job that I was getting extremely well compensated for, and I mean, I had a company car, I had everything. I had every reason not to leave as an executive, as a vice president of operations for a company when I decided to become an entrepreneur. And but I was making somebody else rich, and I kept thinking about, and that bothered me because I kept thinking about, that wasn't my only motivation, but I literally kept thinking about every time I closed a big deal, I just thought, I just made somebody else a lot more money. I got a little piece of it, but I really didn't get what I, but again, it wasn't my company, so I get it. I mean, I totally understand the scenario. Shannan and I will take the same approach in what we're doing. We're doing a lot, taking a lot of risks to get where we're at, but the employees that we're going to hire that work for us aren't going to be able to have the same pleasure of the benefit of the company that we're going to have because of what we took as risk early on. And that's what we're getting rewarded for as entrepreneurs is the risks that we're willing to endure, and that so that was my motivation. Literally, when I I liked working for corporations, but really at the end of the day, I mean, I was in great industries. The automotive parts supplier industry was a great industry. The electric utility industry was a great industry. Those industries are never going to go away. But right. I didn't want to stay in those industries either because like in the electric utility industry, I was bored out of my mind. I mean, there was no challenge. I mean, like today, what we do, what Shannan and I do today, it's invigorating because our challenges are huge, and so that's another part of it, right? If you really want to be an entrepreneur, you better be. In most cases, you better be up for challenges because you're going to see a lot of them.
Yeah. Well, how do you make that jump from the corporate world, playing corporate politics that you did not enjoy? That sometimes I enjoy the corporate politics, but that game can be kind of fun. But how do you make that leap from where I am with I guess it's a false sense of security after hearing both of you talk about an enjoyable false sense of security and naivety, and then going in and saying, all right, I'm going to put it all on the line here. I'm going to start something that's brand new, and I'm going to be an entrepreneur.
For me, it was relatively easy because I'd been doing a lot of side hustle type development work for people. Like I had a natural gas company, for example, that I'd been developing a platform for to do financial nominations of natural gas, which was pretty complex and interesting. But at the same time, I was a vice president of operations for this electric construction and distribution company, and we just closed a big deal. I was with my boss. We were in St. Louis, and it was in the fall. It was probably like in October, sometime in October in the fall of 2001, and we were having dinner, and I told my boss, we were at dinner, I just said, I'm going to be gone at the end of the year. I said, I can't, I had nothing against him or the company, and him and I are friends, but I just said, I can't keep doing this for 20 more years or whatever. He said, this isn't, and he kind of knew, but that was, I was gone. By the end of the year, I was gone. And the mistake I made there was I probably should have waited until February to leave, because I missed the $20,000 bonus that I would have gotten if I stayed till the beginning of the next year. But that gives you an idea, Seth, of how passionate I was about leaving. I knew that bonus was going to be forfeited. Even though I finished the year, there was no way I was going to get that bonus, because I wasn't staying till the end of. Well, I would have probably stayed 2 more months, because I gave them over 2 months notice before I left. But they did end up being a client, our first client as well, so that was a good thing. And they're still a client to this day, so that's a good thing as well. But that I literally made. It'd been on my mind for a while, but I made that decision and I stuck with it. I literally, by the end of at December 31st, I was gone. I had my resignation in and I moved on.
Was there a light bulb moment, or you say it was on your mind, but was there just a morning you woke up and said, all right, I'm pulling the trigger on this thing, I'm done?
Yeah. Well, I was actually, there was a couple things. I was working on some projects. I was at First Energy, and I realized that we could help. If I wasn't at the corporation I was at, if I had my own company, I could actually help companies like them deal with technology challenges that they just didn't have the capability to deal with. And at the time, they were all struggling with trying to figure out how to handle XML data. And that was one of their big struggles. And I was sitting there, it just didn't make any sense that they just didn't have the internal resources to do it. So I just saw all these opportunities. Every time I was at a utility like Duke Energy or anywhere, I would be like, oh my gosh, and not that they're incompetent, because they're not. They're very competent people. The difference is they don't get exposed to the same kind of things that I would get exposed to. So for them, it took them longer. And because of the politics and bureaucracy in corporations, they can't be as nimble as we can be. Like, if Shannan and I talk about something and we want to do it, we can have it done by tomorrow, because we go to our dev team and say, hey, this is going to be good. We want this feature added, and we talk about it. We get it. There's not a whole lot of red tape and all this other stuff. We just add it in, test it properly, and if it all looks good, we deploy it into our production environment.
That's exciting, though, because in the corporate world, it's all committees and hoops you have to jump through. And, I always tell people, from my healthcare perspective, healthcare moves at the speed of smell. I don't know if that's the Tennesseeism of the week in this podcast, but it does. It moves as slow as possible. And Shannan and I had talked about retailers entering the healthcare market. One of those can, from the time they break ground to see their first patients, 90 days. And I always laugh, and I'm like, in my health system, we couldn't get through committee in 90 days to get everybody together to make a decision. But then Shannan's got that experience, and Shannan, as a health information professional, and that's how I met you before you jumped over into the entrepreneur world. How did you jump into entrepreneurship, and how did you and Max come together?
Well, a lot of prayer first. I'll tell you what really was happening with me. It was a combination of a lot of things. 2018, I graduated with my doctorate. And that project, my dissertation, was on the impact of telehealth for Medicare beneficiaries with chronic disease, and essentially providing access to people who didn't easily have access. And my heart is rural health. That's who I am. That's where I want to serve. And so in 2018, we had my dissertation, so I was very studied on that subject. And then in 2020, of course, the world shuts down and people have to start, the industry was forced to use telehealth to, virtual platforms to connect with patients. And so I took the opportunity there I left out one piece. One piece is that also at work, while I very much enjoyed the job I had, I did a ceiling. And I was doing automation projects and process improvement, which is very inspiring and invigorating. I like to make process improvements and do automation efficiency gained from different projects, but I couldn't go higher. I was really at a ceiling, I felt. And so those three things together had me start the first, I said I'm 0 for 2, and it's not exactly true. I'll talk about the number 2 in a minute, because it's really not, it's not a law. But that's right. I'm not 0 for 2. But for the first one, the way that I met Max, I had started a technology center for health with the hopes that plans would continue to pay for telehealth to be just a modality of delivery of care. It's not a new thing. It's not a different kind of thing. It's just, how do we put some quality requirements around a telehealth visit? And so for us, it was, doing it in a local place in an underserved market, so that a patient doesn't have to know the technology and they don't have to feel like they're just in a sterile environment with a computer and it's just me and one doc on the screen. They come in, they're, treated, people are interacting with them in person in their own communities. And there's a whole lot of things I could talk about with that. But the way that I met Max was because my former CEO, when I worked for the Quality Initiative Organization, also knows Max. And so she heard from our beloved Wanda McKnight what I was doing. And she was working as an advisory board member on one of Max's companies. And she said, the two of you should meet. And I don't know if there's any business proposition, but you're both trying to fill gaps and you're both, forward thinking people. You should meet. And so we met through a mutual colleague and quickly became best friends, I think.
Mm-hmm. Yeah.
Yeah.
It was an interesting relationship. We definitely had a interesting connection immediately, and our business opportunity was huge because I saw the model she had, Seth, and it was great. We just happened to have a platform that her model was be excellent on, and she was willing to listen to what I had to say. So that's kind of that's part of being an entrepreneur, though, is that little ability to, like Shannan just articulated, where we talked about something and then we didn't hesitate. We took action on something really quickly. If you look at the timeline of what we've done in enterprise social records, it was really quick in not just the development of what we did, but the decisions when Shannan and I started getting it. We had a lot of trust with each other. That helped, I think, immensely, because we have a lot of respect between the two of us, and we had a lot of trust. We're totally different in skill sets. I mean, my skill set doesn't even compare to her skill set, but what she was able to give us was huge. So that those things are critical when you're doing what we're doing. I mean, being an entrepreneur and having partners, co-founders is tough, but we really, I think we do it very well, I think.
Well, it sounds like the health information industry, at least the networking side, because the health information profession's a small community, right? And I always encourage young professionals and students in our industry to join their local association, join the state association, join the national association, and network. find out what's going on. And it sounds like that networking ended up bringing the two of you together.
Yeah, I always think that truly what drives my progress in work is education, experience, and networking combined. You can have one, two, whatever, and you could use them at different times or whatever. But if you don't have all three, if you don't network, you're missing opportunities that because people don't know who you are. They don't know what your skill set is, and they don't know what you know. And Max is right. Our skill sets are very different, but we make a perfect combination, a perfect marriage, because he's all the tech, all that network, all the security from a HIPAA standpoint, they have on the platform. And then we have all the content, right? I have health information content. I understand the structured language. I understand the unstructured data. I understand the data governance and the end-to-end process, and where we might get in trouble, where we need to steer clear of things. I mean, I don't know all the points where we might get in trouble, but I know a lot of them because of my health information training. So together, like here, if I could give one piece of short advice to any health information professional out there who wants to jump in, find you a Max and make friends. You can't have Max. You can't have Max because I already got dibs, but find a developer who can, who's eager to pursue solutions and go with that. I do want to tell you a little bit of a story about our coming together. Max remembers it a little differently than I do. Well, I was mentioning, I kept talking about social determinants of health because even in Aspect Care, which was the Technology Center for Health, we were focused on social determinants of health for a few reasons. Number one, we're serving in underserved markets. So social determinants of health are a natural part of that. You can't be in an underserved market and not consider social determinants for those folks, right? For whoever's in that community. And so I kept mentioning social determinants of health, and Max was using a platform, not his platform, a different one, that had a social determinant of health component, but I expected that it was like an EMR. And this is not dogging an EMR. EMRs are good for what their core business is and what they do, but their social determinant component is not a robust solution like we have. And so, yeah. Max, actually, I'm just going to let you finish telling the story because I remember it differently.
Well, there's two versions. There's Shannan's version of this, and then there's the real version of this story. So I show her this. I don't know anything about SDOH at the time. I mean, literally, I have like zero knowledge of it, whatever, compared to her especially. I show her this, and she kind of chuckles and goes, "Oh, that's not very good." And I'm like, "What?" and I think she just made the comment because she was so knowledgeable about the space, that it just kind of rolled out. It's a survey, not really an assessment like what we do in our platform today. And at the time, I had no idea what that really meant. So I said to her, well, I was literally curious. I said, well, what do you mean? And then so we scheduled a time to have her show me her model of what they've modeled out and what they were doing with our enterprise social model today. And as soon as I saw it, I didn't know anything about the space necessarily. I had minimal knowledge. But when I saw what she had modeled out and I understood what she was telling me and I could feel the passion that she had about it, and I just asked her, I said, why don't you have this on a platform? And I knew that there was an opportunity right there because it was excellent what she had modeled out and thought through. And we just happened to have a platform we'd been wrapping up that we'd been working on for about 2 years that was a second version of a highly configurable platform to put that on. And it was kind of like fate. I mean, it literally, her showing me that, her making that off comment was really the beginning of that. But she was right. I mean, she was right about the comment. There wasn't anything inappropriate about the comment, but it did trigger all the rest of the events. It was really pretty funny. But
I think I've been on the receiving end of some of those brutal, very true comments.
unfiltered type of comment, right? I mean, yeah, that's why her version is different than the real version. But yeah,
they're all very
Remember,
true.
remember, I'm trying to take less. I'm trying to find somebody to give me grace lessons. Remember that.
Yeah.
Yeah, Max did say though after he saw our so they had been working on that the second generation of their platform for a couple of years, and we had been developing the content for SDOH for about 6 months. So it was about 2.5 years worth of development time combined for these things. But after Max saw what we did, he said, "Oh, you're right. That's not very good. Ours isn't very good." but I did discover if you lay down a challenge to Max, he will try to show you that he can do whatever it is. And so that's how it started. He's right. It was the challenge of, yeah, that's not very good.
Well, it is inspiring to hear how a health information professional can come in with a different perspective and combine that with a technologist to create something that the market needs that's going to be incredibly valuable to the patient population as well as the marketplace as a whole. And that should inspire the health information professionals that are listening to us. And Shannan, I guess that brings me to the question to you of, you went through your RHIT program. You went down sort of the traditional path at first in health information, but here you are as an entrepreneur. How does somebody make that jump from health information and use that skill into a brand new world?
I wish I could say that it was just one thing or give you that one, unless you can just find a max. If you can find a max, then you got no worries, right? Just go find that person and be bold. No, don't do that. Don't do that. Do some planning. But it does take a combination of all of those things, education, experience, and networking. It takes that, but it also takes your own self-confidence. You have to be bold enough to take a risk. I mean, it's a huge risk. It really is. And you could get, I don't know the scientific or mathematical formula that says, should you stay at a corporate job or should you become an entrepreneur? I'm not sure kind of how you flesh that out in terms of a schema, but I would say that being able to speak to whatever it is that you're addressing with confidence because of knowledge, but also because of passion are good places to start. So education, experience, and networking, but beyond that, getting involved in the national conversations, whether it's industry or your health information specific AHIMA conversations to help build best practices, or at your state level to serve at the state level, or even on one of your program groups or your work groups or committees for data governance or coding and analytics, different things like that. But don't miss out on the opportunity in your own organizations. So I was passionate about data governance in my most recent former role. And because of that, there was a position to really build an end-to-end data governance program that was an enterprise-wide solution for diagnosis and procedural codes. So because of my passion for data governance, I had already gotten involved with the data governance steering committee. And so I was already in my organization. I was a voice, right? So I went to this knowing that I know content governance and that everybody else in there almost were IT and they knew IT governance. And it's a hard conversation. I won't say that those things were easy because not all of IT accepts the information from a health information professional because they think that we are saying something that's minuscule when in fact we're telling, like, everything we own tells the story of a person, right? So you have to put yourself out into a space where you're uncomfortable. And it can be a little bit at a time, but then you learn more. And then as you learn more, you go into the next phase. And then you learn more and you go into the next. And it's just this cycle of learning, contributing over and over. So you have to first empower yourself by understanding something, whatever it is you want to work on, and then equip yourself to be able to have conversations at every level. That's one thing, one thing with health information professionals. I know we talk a lot about those soft skills that are missing and some of those professional skills. You really do need to sharpen your communication skills, because how you speak to a person that is maybe doing the data entry into a platform is not the same as a conversation with a developer who's creating the platform, and it's not the same as the internal champion for that program or that project that you're doing. So you have to be able to communicate on all those levels. And something that I do still work on, truly, this is a limitation of mine, and you all have both pointed it out. I don't always handle it gracefully, right? Like and it's not, I'm not doing it to be rude or mean. It's just I'm focused on completion or doing something well. And so I'm just direct about it. So being able to communicate where people will be willing to listen because they're not offended by your tone or your question, that's something I still work on. That's a lot of things, but any questions about that? Follow up, Josiah?
No, I mean, it's truly inspiring.
When was that?
Yes.
Uh-oh.
You can.
Corporate company title is Squared, which stands for Ronda Rousey. Because I started calling her Rousey because there's a story there. But anyway, she's, as you know, she's a fighter. So there's no doubt she's not afraid to kind of tell you the way it is. So. Yeah.
That's a fun nickname that will probably stick, and I think I'm going to change Shannon's contact info in my phone to R Squared. Well, this has been a great conversation. It should be inspiring to our to the health information professional that's out listening to this or watching this. And Shannan, I'll put a plug out there that says I'm sure you'll talk to any of the health information professionals that are considering taking the leap into the entrepreneur world. Reach out to Shannan, get some advice, network with Shannan, and that'd be a great way to develop the idea that you have. So I want to thank you both for being here as guests, and Shannan, as always, as my co-host here at HIPcast. This has been a lot of fun. I will say that my fear is still there, but I like my false sense of security now that I know that it's false. But I'm sure that there are those out there that are listening that maybe have crossed that threshold from fear to excitement, that they can start their own journey in this world. And again, I want to thank you. And I do want to thank our sponsor for this episode as well, Enterprise Social Record, the only closed-loop referral solution for social determinants of health needs built with health information expertise. Again, ESR allows clients to assess, refer, report, and trend the SDOH needs of people in their care, report quality metrics like HEDIS and MIPS, and ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. Thank you both, and Shannan, I will see you soon.
All right. See you next time.
Thank you, Seth.